Hi, hello, good morning everyone. Welcome to a very wonderful session of medical and surgical nursing on my channel Healthcare Hub. Today I'm going to discuss the most high yield and important topics from medical and surgical nursing which there are chances to be asked in our AIMS NORCET 6.0, and I'm very happy to see the audience who are liking my channel and encouraging my channel, and you have come so far. And if you wish to see more and more videos from my channel, please like, share and subscribe my channel. So coming to the NORCET 6.0, as you know already, the notification has been released. If you look at the notification, so there are almost two rounds, that is preliminary as well as mains. So from today onwards, if we calculate, there are only 1 month and 10 days, around 40 days time from today onwards. So start your preparation. So I'll be taking the most important topics from MSN. So the topics will be included here. So the topics will be like fracture and its types, compartment syndrome, traction, types of shock, cirrhosis of liver, angina, and a cerebrovascular accident and myocardial infarction. So these are the topics I will be covering. And if you look at the exam date, it is on 14th April, that is on Sunday. And again, the second stage is on 5th May. So almost around 14th May to 5th May. So you will be hardly getting 2 to 3 weeks time. So between these exams, if you look at the preliminary round, it is tough compared to the mains round. So whatever I have got feedback from the NORCET 5 people, they have informed me that the preliminary round was much more difficult compared to this mains round. So be thoroughly prepared, be thorough with the concepts and plan your schedule accordingly, that you are giving maximum of the time for the theory part and basic concepts preparation. And I advise to all the NORCET aspirants, if you are preparing for your exams, don't prepare at the night time. Means at the end of the day, don't prepare, where you are fully completely occupied with your daytime routine. And if you are preparing at the night time, it will be very difficult for you people to keep it in the memory. I mean to say, like short-term memory, long-term memory. If you want to have a good preparation, learn things nicely and thoroughly, go for early morning preparation. Means hardly 2 hours or 2 to 3 hours preparation, daily morning preparation is very very good, and where it will stay in your long-term memory. Means if you want to remember for a longer period of time, go for an early morning preparation rather than night preparation, and good have a nice healthy sleep and sleep early. Don't involve yourself much in this mobile things and all, and stay away from these electronic gadgets and try to sleep early, and allot yourself morning 6 to 9 or morning 5 to 8. So this time 6 to 9 or morning 5 to 9, allot this time for preparation. If you are given more evening duties or night duties, so see to that you are allotting this morning sessions for your this preparation itself, compared to this complete day work after day work, and end of the day if you are preparing, definitely it is going to stay only for your short term memory. And eat well, be hydrated, stay away from the junk food, maximum try to eat the home food and go for the preparation. And if you look at the pattern of this exam, around 100 MCQs they are going to ask. In that, so there are around 5 sections, section A, B, C, D and E. And if you look at the question pattern also, around 80 questions are going to be get asked from this MCQs from the nursing, which will be major subjects like medical and surgical nursing, child health, mental health nursing, and the rest of the subjects like microbiology, nutrition, anatomy and physiology. So most of the topics will be from the MSN, MHN, community health nursing, child health nursing. So rest of the other topics, other subjects you can prepare, but brush up the basic concepts from those topics. When you look at the 20 MCQs will be from general knowledge and aptitude. If you look at the general knowledge, if you want to know the questions about general knowledge, please update yourself with the latest newspapers or daily newspaper in whichever language you people prefer. Depends upon your mother tongue. It may be Hindi, Telugu, or whichever mother tongue you prefer, or if Hindu paper is available, well and good, you will be knowing the general knowledge. If not like that, your local paper you can prefer. And if you don't have time to read newspaper, download at least any latest news app, so that whatever the news, general knowledge related news, or the Hindu app, so that you will be updated with this general knowledge questions through the latest, through the newspaper, or general daily news will be useful. So around 20 questions will be asked from the general knowledge and aptitude. And you look at the negative marking, around 1/3 marks are awarded for each wrong answer. So imagine, so around 0.33% of negative marking is there. So if you are giving like around 25 wrong answers, if you are giving, around 16.5 marks will be, so around 16.5 marks will be deducted. So if you are giving around 25 wrong answers, around 16.5 marks will be deducted. So try to understand, so around 0.33% there is a negative marking here. And this time they have gone for like around 20 questions in 18 minutes. So within 18 minutes you have to attempt the 20 questions. And be careful, there we have already mentioned about this negative marking. So questions which are you people are really thorough, go for that marking that question. If you are not sure, then instead of attempting that question, better to leave. So you know now, as negative marking is there, better to leave those questions. If you're completely thorough, then only you attempt. And once you finish one section and you are going to the other section, so the sections have been divided in such a way, so whether you attend or not, whether you give an answer or not, once this 18 minutes are finished, automatically it will go to the section B, section C, section D and section E. So once in your section, be thorough with the questions and try to understand. See, once you are knowing the concepts very well, they may try to they may try to twist the questions, or they try to understand the first question, then it will be very easy for you. Now I am taking the medical and surgical nursing questions now. So in these questions you can find out what is the exact question they are asking and how they are going to distract your question by giving MCQs or giving a very big question, so that it will be able to distract or confuse the person. So around 18 minutes, so 20 questions. So be thoroughly prepared, and let me start our session today. So here the question is nurse in the emergency department. So nurse in the emergency department, and she is assigned with around 4 clients. So here 4 clients are there. 4 clients are given to the nurse, and the 4 clients are given with, and she has received 4 clients with, one is head injury, one is fractured femur, and the other is ventricular fibrillation and the penetrating abdominal wound. So when you look at this 4 diagnoses, so if you look at the head injury, fractured femur and ventricular fibrillation, penetrating abdominal wound. So if we look at the head injury, out of these 4 diagnoses, so which requires more attention compared to head injury? Okay, next, if head injury with the bleeding, then it should be attended immediately. Here they have mentioned only about head injury. And fractured femur, okay, if then is open bleeding, hemorrhage or skin breakdown, or at that time we can wait. When you look at the ventricular fibrillation, here ventricular fibrillation is something which is related to heart. So if heart is not pumping, blood to the brain, what will happen? So immediately the client will go into, it is an imminent part of the death. Means compared to these two, compared to head injury, fractured femur and penetrating abdomen, this ventricular fibrillation, this particular patient requires more attention compared to the rest of 3. So like that, when you are getting the multiple MCQ questions, you have to rule out which one is the priority. What is the according to the priority we are going to select. So compared to this head injury, fractured femur, penetrating abdominal wound, the nurse should go with the patient with ventricular fibrillation. Because ventricular fibrillation will cause irreversible This will cause irreversible brain damage to the patient and also death within minutes. If you are not giving the priority to the patient, within minutes there are chances the patient may get into death because there is no pumping blood to the brain. If there is no pumping blood to the brain, immediately the patient, there may be a chances of death. And defibrillation or CPR will be given until the defibrillation or CPR is possible, must be initiated immediately. Then the rest of the diagnosis, whatever the nurse is going to get, it requires prompt treatment, but it is not as important as ventricular fibrillation. So compared to these three, the ventricular fibrillation needs more attention. So understood? Let me go with the next question. Okay. So Colles fracture is, Colles fracture is the fracture of distal end of the same species, distal and proximal end of the radius and distal end of the radius and shaft of the humerus. Here they have mentioned about Colles fracture. So what is this Colles fracture? Colles fracture, here if you look at the hand, so here we are talking about proximal and distal is nothing but, if you look at the human body, we are going to talk about from the midline. So midline is here, and from the point of attachment, if you look at the point of attachment, it is the point of attachment. So this is the proximal, isn't it? Then if you come to this one, this is the distal end. So here they have mentioned about distal end of the same species or proximal end of the radius or distal end of the radius. So here Colles fracture is nothing but, if you look at the hand here at the wrist region, when there is a fracture at the wrist region, that is called as Colles fracture, and that too the hand will be so when you look at the hand, the outward fracture, my image is also not coming properly. So imagine this as a hand. Okay. So near the wrist region, the outward fracture. So near the wrist region, the outward fracture, the lateral side. So this is nothing but the distal part of the radius. So when you look at the here, this is the nothing but this is the distal part. So compared to these three options, option A, option B and option D, means the shaft of the humerus they have mentioned. In Colles fracture, this shaft of the humerus doesn't come. So here we have to look at this. So this is Colles fracture. When I wrote this one of the central government exam, I got this question regarding this Colles fracture. So here the answer is nothing but distal end of the radius. So option C is correct. Understood? So option C is correct. So proximal, this is not from the point of attachment. So distal part near the wrist, that is called as Colles fracture. So think my explanation is clear and enough for you people. And this Colles fracture is mostly due to the caused by falling on the outstretched hand, and it is mostly common in 50 years age group. If you look at this one, mostly in 50 years age group are more prone to get an outstretched part of the hand. We can see this kind of fracture. Then as we are already now we have come to the topic of fracture, let us see the different types of this fracture. So coming to this Potts fracture. So you know what is the meaning of this Potts fracture here? So Pott's fracture. So Pott's fracture is nothing but when there is a fracture to the distal end of the lateral leg, usually near the ankle joint, that is called as Pott's fracture. So when you look at this image, just look at this image, it will be easy for you. So when you look at this image, when there is a ankle fracture, Pott's fracture or ankle fracture. Here, can you look at this ankle fracture here? So, ankle fracture where the malleolus or the bony protrusion. So, here we have this malleolus. The bony protrusion is there now. The bony protrusion part, malleolus. When there is injury to the bony protrusion part here, malleolus, we can find. So mainly this Pott's fracture occurs when the person is landing from a jump or rolling, whether he is rolling or sudden jumping. When the person is suddenly jumping, at that time we can see this Pott's fracture, P-O-T-T-S. This is called as Pott's fracture, mainly seen in the bony malleolus. Then the other one is fracture of Allis sign. So when we are going through this fracture topic, there are few very important key terms. When you look at the key terms like Allis sign, positive Trendelenburg sign, then Pagets disease. So I will show the images of whatever the key terms I have mentioned here. Na? The Allis sign, positive Trendelenburg sign and the Pagets disease. We will see images of all these signs one by one. So here Allis sign. So this Allis sign is to assess the hip dislocation. Can you see the hip dislocation here? This is Allis sign. To know the hip dislocation and to also to check the developmental dysplasia of the hip. To know the developmental dysplasia. So this is the Allis sign, this particular thing. So this is Allis sign. Can you look at the hip? So here, due to the improper development of the acetabulum near the pelvic bone, so when you look at this joint, so due to the development of developmental dysplasia, hip dislocation, that is we call it as Allis sign. So here I have written the Allis sign. Can you see the unequal parts here, this side and the difference here? This is called as Allis sign. The next one is positive Trendelenburg sign. Positive Trendelenburg sign. If you look at the positive Trendelenburg sign, one hip. So here the positive Trendelenburg sign is nothing but the pelvis on the affected side is down. So on whichever the side the pelvis is there, that pelvis side will be down. This is the pelvis. If you look at this pelvis bone here, when you look at this pelvis bone, you can see. So here the pelvis bone will be on the down side. So that is called as positive Trendelenburg sign. Understood? Then next one is Pagets disease. So here Pagets disease is the we also call it as the osteitis. So osteitis, and the cause is unknown, affecting mostly the older people are more affected for this Pagets disease. So look at the image. So this is the image of the Pagets disease. Here the bones grows to be, here the bone, when you look at this image, the bones grow to be larger and they become weaker. And they become weaker than normal usual pelvis, than the normal one. And usually if you look at this Pagets disease, it mainly affects the pelvis and also skull. Pelvis and skull is mainly affected with this Pagets disease. Here if you look at the bone deformity here the bone will grow large in size and it will become weaker. So this is called as Pagets disease. So just now we have discussed about the Colles fracture. So Colles fracture, what I have told? Colles fracture is near the wrist joint, outstretched joint. This is Colles fracture. And we look at the Potts fracture. He is near the leg, lower extremities we can say. Then hip dysplasia, this is Allis sign, and this is positive Trendelenburg sign. So these are the key terms which we are supposed to learn when it comes to the fracture topics. And let us see the the detailed explanation regarding this fracture. So when you look at the fracture is a break in the continuity of the bone. I will take only briefly, not too deeply. So here mainly the fracture is caused due to direct blows. Direct blow is directly falling down or falling from a certain extent of height. Crushing forces, like there is any crushing forces is any accident type at that time. Sudden twisting motions at that time there may be chances, and extreme muscle contraction at that time we can see this fracture. And if you look at the fracture is of two types, complete as well as complete fracture and incomplete fracture. Fracture is of two types, complete fracture and incomplete. So a complete fracture is nothing but when we look at this bone, let me go here. So complete, this is a complete fracture where the bone is completely divided into pieces called as complete. Whereas incomplete fracture is where the fracture will be there, but if you look at the bone, there will not be, so it will be incomplete. This is sometimes also called the greenstick fracture. So this is complete and this is incomplete. And there are types, that is so when you look at the types of fractures, so depending upon this complete and incomplete, there is open and closed and open fracture. So closed and open fracture is where when there is a involvement of the, if this is bone inside, this is closed fracture where the fracture has happened but there is no damage to the outer skin. This is called as closed. When the bone is completely out of the skin, so this is the skin and you can see the bone outside, this is called as open fracture. So here open fracture has been again divided into grade 1, grade 2 and grade 3. So here grade 1 means that is less than 1 centimeter. When there is a open fracture where the open wound is, if it is less than 1 centimeter, then that is called as grade 1. If you look at the grade 2, so if you look at the grade 2, here the grade 2 is a larger wound with extensive soft tissue damage. Means the soft tissue, what if you look at the hand bone or leg bone, so if the skin completely around that particular, if the leg, this is the bone here inside, and if there is any soft tissue damage, then this is called as grade 2. And in the third is completely highly contaminated, where there will be complete bone damage and the skin around that particular bone is completely damaged, then that is called as grade 3 fracture. Here it will be contaminated, fully soft tissue damage we can see, and this is the most severe form of fracture. So I will show you the images of all the types of fracture now. So this is simple fracture. So here you can see the image. This is simple fracture. So this is simple fracture you can see, where there is no damage to the skin, only the particular bone is completely here that is damaged. So fracture that remains contained and does not break in the skin, this is called as simple fracture. The next one is compound fracture. So when you look at the compound fracture here, so this is a compound fracture. Here it involves skin and the nearby mucous membranes, and it is almost most of the time this is open fracture. This is a open fracture in which both end of the broken bones will come out. So this is a one type of open fracture, and this is called as compound fracture, where there is a damage to the skin. In simple fracture we don't have damage to the skin, whereas in compound fracture we can see the damage to the skin. The next one is comminuted fracture. Here the comminuted fracture is, you can see the image, the bone fragments. So when you look at this bone fragments, they are become into multiple pieces. So can you look at the image here? Yeah, multiple pieces, the bone fragments are there. This is called as comminuted fracture. Then green stick fracture. If you look at this green stick fracture, I have already told, here this is an incomplete fracture. If you look at this stick, raw stick, the raw stick, when we try to break it, at one end it will be broken, this one, the other end it will be intact. This is called as green stick fracture. And mostly there may be in exams you may get questions like, which is the type of fracture mostly seen in children? Mostly seen in children. This is one such MCQ. So what is the most common type of fracture in children is, that is green stick fracture. So you may get MCQs like this also. They will mention simple fracture, comminuted fracture, compound fracture, but the most common type of fracture is, that is green stick fracture, mostly seen in children. Then the next one is depressed fracture. Here the depressed fracture, I have shown you the image. So when you look at this image, here depressed fracture, we can see the image of the skull. Here the bony fragments, so the bony fragments will be depressed. So this is the, when you look at the skull bone, the bony fractures will be depressed. And it is mostly seen in skull as well as facial bones. We can see this depressed fracture. Then epiphyseal fracture. As you know the parts of the bone, right? So the upper two ends. The upper two ends are called as epiphysis. So in a bone, this is epiphysis, and the middle portion of the bone, the long stem type, long type of the bone is called as diaphysis, whereas the upper end and lower end is called epiphysis, and the portion between epiphysis and diaphysis is called as metaphysis. So when there is a fracture to this epiphyseal end, that is called as epiphyseal fracture, and this is diaphysis here, this is diaphysis, and these two ends is called metaphysis here, this is called as meta, and the upper two portion is called as epiphysis. So when there is a fracture to this upper end and lower end, that is called as epiphyseal fracture. That's it. See, no need to mug up all the content, just try to understand the basics. It will be easy for you to understand when there is exams. And when you're writing this NORCET exam now, inside that particular, wherever they will be allotting usually this software jobs type of environment there. So you don't come into pressure. Within 20 minutes I have to finish that particular exam. Don't be in that pressure. Relaxly think and write just mark the correct answer. Then comes the impacted fracture. So impacted fracture, when you just look at the image here, so you can see here. So here the impacted fracture, whatever the fracture has happened, it will press over the lower bone, that is called as impacted fracture. So in fracture, one part of the bone fragment is driven into the other part, that is called as impacted fracture. Then transverse fracture. So transverse fracture, when you look at the transverse fracture here, so in the transverse fracture, Here the fracture is happening straight across the bone, means it is dividing upper portion and into the lower portion. That is called as transverse fracture. And when you look at my YouTube channel, in the community tab, I have posted the same questions regarding this, all these topics, and I have answered the question regarding the same. But when you look at the answers now, I will show you now one by one. And if you have come so far in my class, around 23 slides got over, if you come so far, kindly subscribe my channel and like the channel and share in your nursing groups also. If you are from a nursing student background or you have working in any hospitals, please share it in your nursing groups, in your classmates groups or in your friends group, especially in the nurses, which will be useful for them. Then this is oblique fracture. When you look at the oblique fracture, this is oblique fracture. This is oblique fracture where it is occurring along the angle of the bone, that is called as oblique fracture. It is less stable than the transverse one. Then spiral fracture. So mostly people get confused between the oblique fracture and this spiral fracture. Oblique is, so when you look at the oblique fracture will happen like this, whereas in a spiral fracture it will be happening around the shaft of the bone. So that is called a spiral fracture. And don't confuse you people from oblique and spiral fracture. So these two are different, and I have posted the same question on my YouTube page. If you look at my YouTube page now, on the community tab, I have posted the same question. So here most of them have selected, so identify, the question was like, identify spiral fracture, a fracture that twists around the shaft of the bone. So I have told, here the question you can clearly see, around the shaft of the bone, this one. But most of them have selected this first option. See how people are easily confused, and around 67% of people have gone for this particular option, thinking that this is the correct answer, whereas spiral fracture is which happens around the shaft of the bone. Here it is clearly mentioned, spiral fracture, shaft of the bone. So shaft of the bone is nothing but this portion, and again people have selected this one. So be careful when you are writing the exam or when you get image based questions in your exams. So be careful with that. So just summarize this topic. So this is a green stick fracture, and this is oblique and transverse is like this, and this is open fracture where you can see the mucous membrane, skin, soft tissue is involved, that is called open fracture. And this is impacted or telescope type fracture is when bone is completely impacted into the other one, that is called as impacted. Spiral is happening around the shaft of the bone. Comminuted hip fracture is, that is nothing but the pieces when we can see, that is called as comminuted type of fracture. So easy, understood everyone? Then next one, this is avulsion type of injury. Avulsion fracture is when there is a pulling force, great pulling force, where you can see due to the pulling force that particular bone fragment comes off. That is called as avulsion type of fracture. And this is compression. So this is compression type of fracture. Here you can see this is the vertebral column. So in the vertebral column you can see this compression type of fracture. So when we are learning this topic, you must know what is the ligament and what is tendon. So here in the avulsion type of injury, we can clearly see this is the ligament. So ligament is nothing but where two bones, ligament is which connect two bones. So here you can see now, when there is two bones, so the connecting portion is called as the ligament. And the tendon is which connects muscle. So this is the muscle here and this is the bone. So tendon is which connects muscle to bone. So understood the difference between ligament and tendon? Ligament is bone to bone, whereas tendon is muscle to bone. So avulsion injuries we can see in this tendon type of avulsion injury we can see in both, but for clear understanding I have used this image. So just briefly describing the signs and symptoms. When you look at the signs and symptoms, so pain will be there and fracture and deformity. If you look at the deformity here, this is called as fork spoon deformity. Fork spoon deformity, or we can also call it as, this is called as Colles fracture, that is outward fracture here at the wrist, outward fracture. And whereas Smith's fracture, this is inward fracture near the wrist, that is called as Smith's fracture. And if you look at the other signs and symptoms, there will be loss of function from where the injury is happened. From where the injury is happened, the lower portion, there will be a loss of sensation or tingling, numbness sensation in the other extremities. And then there will be other symptoms like shortening of the limb. Shortening. Here you can see this is the shortening of the limb. Compared to this extremity, the affected extremity will be shorter. Understood? And this is an example of ankle fracture. And crepitus. So in comminuted fracture, I have told comminuted. Comminuted fracture, the bone fragments will produce sounds, that is called as crepitus. Excuse me. So have you heard of this compartment syndrome? So when you look at this compartment syndrome, so this is the cross section of the muscle. This is the cross section of the muscle. So here this is the normal muscle tissue. All these things are muscle tissue, and we can see the blood supply. So here the blood supply, you can see there is no constriction of the blood supply. But where in a compartment syndrome, we can clearly see that there will be, the muscles will be, it will be most of the time the enlargement of the muscles compressing the blood supply here. Here the blood supply will be compressed and the muscles will be enlarged, causing decreased blood supply to the lower extremities. It can happen when we will do dressing or application of spica, cast, or when we apply too tight dressing, or when the patient does any vigorous exercise. At that time we can see this enlargement of the muscles. So due to the enlargement of the muscles, the veins, the blood supply gets decreased to the lower extremities. Especially lower extremities, we can observe this compartment syndrome. So this is before compartment syndrome. When after you look at the compartment syndrome, all the muscle gets inflammation and the blood supply, all the veins, arteries and veins, these get compressed. So due to compression, we can see the enlargement of the muscles and decreased blood supply, and the patient will have complaints of like we have 5 P's to assess this depression, 5 P's to assess. So when you look at the nursing management, or when we apply this cast, for fracture cases we apply this cast, cast, splint, brace. When we apply, so we have to assess for these 5 P's, that is pain we know, pallor means compared to the rest of the body extremities, that particular organ will look pale in nature, that is light from the rest of the body organs. Pulselessness on the organ. Paresthesia is pins and needle sensation. So the client will have pins and needle sensation, and the paralysis will happen. So this is also one more MCQ. So when it comes to how you will assess the neurovascular status. So when you assess the neurovascular status, all these are the 5 P's: pain, pallor, pulselessness, paresthesia, and paralysis. See, whatever the content I am posting here, I will update the same in my Telegram channel. So now, if you want the notes, I will be updating in my healthcare hub. In my Telegram channel, I will update the same notes in that particular channel. So you can get the notes from my Telegram channel. So when I have gone through these questions related to the fracture, most of the time they are asked questions more from the hip fracture. Compared to the other topics, hip fracture they have asked most of the time. So let's go through the question. So to reduce a hip fracture, the client is placed in traction before surgery. So traction, I will tell you, traction before surgery for an open reduction and internal fixation. Because the client keeps slipping down the bed, increased contraction is ordered. So how does the nurse increase the countertraction? So to understand this question, you must know what is traction, what is countertraction, and how it is going to help the patient who has got fracture. So we need to, so the options given here are elevate the head end of the bed, add more weight to the traction, use a slight Trendelenburg position. Trendelenburg position is nothing but the head will be down and the foot will be elevated in the bed, and tie a chest restraint around the client. Means if the patient is there, around the chest we need to tie any restraint. What the question here is about, here the client is, before, when the open fracture cases they are posted for surgery, the patient will have this traction process. So why this traction process is applied, and when we are applying this traction, how the counter traction, there should be equal force from the both side. When we are applying traction, there will be equal force. When there is equal force, then only the healing will takes place properly. Otherwise, this muscle spasm at the fractured joint, especially the lower extremities, the fracture part will go into spasm and there will be abnormal fusion of the bone. To prevent that, we are going to do this traction process. So here what we are going to say, so here the correct option would be so elevating the foot of the bed, which uses gravity as the client's weight of counter traction. So here I will show you the image. Yeah. See why we are applying traction here is, so this is the fractured part and we need to apply traction. Why? When there is a bone fracture here, there will be, the bones will be aligned, malaligned. It will not be aligned properly. So to prevent that, before surgery we need to align them in a correct posture. To align them in a correct posture, we tie them to a traction with weight. So here already the patient body is there. So here the patient body, what it will do, it will act as a counter traction. So due to the gravity force, when we make the patient down here and we elevate the foot end, the weight will act as a traction and the body of the patient weight will be acting as a counter traction. So understand the meaning of traction? So traction is nothing but creating the tension between the bones, so that this is traction, counter traction, and the malaligned bones, the broken bones will come into a proper place. For that only we are going to apply bone traction, skin traction. So there are different types of tractions are also there. So the correct option for this question is use a slight Trendelenburg position. When we use the Trendelenburg position, the patient weight will be acting as a counter traction. Okay, next question. So a client with a fractured hip is placed in a traction until surgery can be performed. What should the nurse explain the purpose of the traction? When the patient is coming to you, why you are applying traction? So as a medical professionals, we know what is the meaning or what is the traction and all. But when the same patient attender is asking, we are going to say to prevent contractures. So what is the meaning of contracture? The options given here are relieve muscle spasm and pain, to prevent contractures from developing, and to keep the client turning and moving in the bed, maintain the limb in a external rotation. External rotation is when the patient is lying down, the foot will fall onto the left or right or left side. That is called as external rotation. It will not be straight. That is external rotation. And to prevent contractures. Contracture is nothing but stiffness or shortening. Contracture is nothing but shortening. As one of the symptoms I previously have shown the images now, to prevent the contractures from developing, we are going to tell the patient attender or patient to prevent the shortening of that particular limb, we are going to apply the traction to prevent this shortening. Shortening as well as stiffening of that particular fractured part. So traction is nothing but this is the process of putting a limb, bone or a group of muscles under tension by using the weights and pulleys. So it is mainly done for to proper alignment and to relieve muscle spasms and to correct and prevent deformities. Because deformity is, it will fuse in a wrong manner. That is also one kind of problem. And especially for this spinal cord compression and dislocation, intervertebral disc, back problems, for painful muscles, ligaments, we are going to apply this. We are going to apply the traction. So there are different types of traction. So here, so image-based questions are very, very essential if you are getting image-based questions. So this is nothing but the cervical traction. So this is problem with my pen. This is cervical traction. See, image-based questions are going to stay for a longer memory in our brain. This is called as cervical traction. And you look at this. This is called as box traction. Especially when there is any hip injury, at that time we are going to apply this. So here these are the two legs here, and for that they have tied the pulleys with weight. This is called as box traction. So now the image is clear to you. So this is called as box traction. This is the box traction. We are going to get into another topic, that is so next question is, the client has severe liver disease. Which of the following observations is most indicative of serious problems? So the client has generalized urticaria. The client is confused and can no longer write his name legibly. The client is jaundiced and the client is ecchymotic areas on his arms. So here the question is, the client has severe liver disease. That is nothing but the cirrhosis of liver. So here they are talking about cirrhosis of liver, and the client has general urticaria. Urticaria is nothing but when you so you know about mosquito bites, right? So when mosquito bites you, how your skin appears. So that is called as the rashes. When you look at the rashes, that is urticaria. The rashes you can see all over the body. So here the client is having urticaria, which is not related to the question, and the client is jaundiced. This is also one of the signs and symptoms. But here, which of the following question is, which of the following observation is most indicative of serious problem? So the client is jaundiced, but not to the level where the client is unconscious or the client is not responding to you. And the client has ecchymotic areas on his arms. Ecchymotic is purple color discoloration under the skin. So purple color discoloration on the skin or the hand. So this is not going to hamper any circulation or breathing pattern of the patient. Here the client is confused and can no longer write his name legibly. Legibly is the client is confused and disorientated and is not able to remember his what he is, where he is, which place he is, or he is not able to tell why he is here. So at that time, this will be the correct option. So the client has severe liver disease. Which following observation is most indicative of a serious problem here is the client is confused and he is not able to write his name legibly. Rest of the options are only for are also there, but this particular question here, this particular option is the priority. So when you look at the when you look at the liver, so this is the liver. So this is the liver here. So here the liver is divided into right lobe and left lobe, right? So here you can see the round ligament. This round ligament is nothing but during the fetus period, this itself is the umbilicus. So that is the round ligament here. And here we have the right hepatic duct. So this is the right hepatic duct, this one, and this is left hepatic duct. So where this right and left, here they are going to join into a common hepatic duct, and this is the gallbladder. So this gallbladder you can see not on the anterior side but on the back side of the liver. Hope this session is not drowsy for you. So till now we have discussed about type of fractures, traction we have discussed, compartment syndrome we have discussed. Now we are going to the cirrhosis of liver. So in cirrhosis of liver, the most important thing is what? We have to know the normal liver and the abnormal liver. Here the liver is divided into two lobes, right lobe and left lobe. So in the right lobe and left lobe, we can see the gallbladder is here on the posterior side of the liver. So these two, the gallbladder, the right duct and the left duct, they pour their secretions into this common duct. And you look at the duodenum, here your duodenum is going to receive all this. From the bile they are going to receive, from the pancreas it is going to receive. So all these three secretions are going to form in the duodenum, which is going to alkalize the food whatever the person is having. So understood this one? So in the liver we have this Kupffer cells, or your actual pronunciation is Kupffer cells. So these are essential, and the hepatocytes here, they produce bile. So the liver produces bile, which is very essential for the emulsification of fats. As you know, the lipids, fats, whichever is on our body is there, that bile is essential. So this is nothing but this is the Kupffer cells, and here we can see the phagocytes. So here phago means what? Phago means eat. Say sites means the cells. So these phagocytes are going to play a vital role in engulfing the microorganisms. When you look at the right hepatic duct, left hepatic duct, then we have common hepatic duct of the liver, then cystic duct. From the gallbladder, again bile juice will come, common bile duct, and here in the duodenum all these things are going to mix up. So when you look at the cirrhosis of liver, the normal signs and symptoms is like, so depending upon the signs and symptoms only we will get nursing interventions, and depending on the nursing interventions in the exam, they are going to put the same nursing interventions into the question and answer. If you look at the question and answers here, in most of the channels what I have observed is, mostly they are not focusing on the nursing interventions. See, medical management and nursing management is there, but when it comes to the part of the nurses, nursing management is also very, very, very important. So when you look at the signs and symptoms of this particular cirrhosis of liver, we have fever, jaundice of the skin, and the white color portion of the eye, sclera, it will be looking yellowish in color. Then all the jaundice of the skin, sclera, and the mucous membranes, and the patient will have lack of appetite. Thus the patient doesn't feel hungry, the patient will have nausea, vomiting, and the patient will have a enlarged liver, and the spleen enlargement also we can see, and ascites, that is distended abdominal veins, all these things we can observe, and the patient will have decreased serum, decreased bilirubin, bile will be decreased, and serum albumin will be decreased. So sorry, the bilirubin will be increased because when you look at the liver, so this is the normal, this is the brown color liver. When the normal liver tissue is replaced with the sclerosis or fatty liver, so this is the fatty liver, cirrhosis of liver, fatty liver, all the terms are same. Cirrhosis of liver, fatty liver, so both the terminologies are same, don't confuse yourself. So this is the normal liver. When you look at this fatty liver, the fat deposits over the liver causes the enlargement, and gradually the cells are replaced with fibrosed cells here. So later it will cause cirrhosis, and you can see the image here. This is the cirrhosis. Let me show. Okay. So this is the normal liver, and gradually the fat cells occupy, means the liver fibrosis will happen. It will cause the damage to the liver. This is called as cirrhosis of liver. Here the serum bilirubin will be increased and the serum albumin will decreased. So that is nothing but albuminemia, hypoalbuminemia, and this is serum bilirubin will be increased. So depending upon the complaints, we are going to treat the patient. So the nursing interventions will be mainly, we are going to focus on the patient will have, we are going to advise low sodium diet to the patient and diuretics. So diuretics we are going to administer, and the patient will have a complaints of itching, skin rashes, urticaria. At that time we are going to advise the calamine lotion. And as I already told you, the patient albumin levels, serum albumin is nothing but albumin globulin, the proteins present in the blood will going to decreased. Then this is the patient, we have to, as the ascites complaint will be there. Ascites is, that is fluid accumulation in the abdomen. So because due to fluid accumulation, we have to monitor the patient weight, and the fluid, when there is more fluid accumulation, we are going to draw the peritoneal fluid. So for that we need to IO chart we have to maintain. And if the patient has the history of chronic alcoholism, at that time we are going to advise the patient not to have alcohol. So as all of you have, sorry. So as all of you have understood all the topics so far, and so if you look at the answer for this particular question, this is, so the client is going into hepatic coma and he will have urticaria from the jaundice, but this is not the most serious problem here, and he will also have this ecchymotic areas on his body due to the decrease in prothrombin. Because there will be a decrease in prothrombin level, the patient will automatically have this bleeding tendencies, and which is made in the liver, but this is not also the most serious problem. So when you look at the question here, so I have already told the client is confused and can no longer write his name legibly. And if you come so far in this video, I request all the subscribers to please like my channel and subscribe my channel, and also share in the nursing groups, and the rest of the topics which I have told earlier, like types of shock, angina, cerebrovascular accident, all these topics I will take in the next part. Okay, angina, cerebrovascular accident, and yeah, that's it. So all these topics I will take in the next part. So stay tuned. Thank you.